The National Coalition for Cancer Survivorship advocates for quality cancer care for everyone touched by cancer. Founded by and for cancer survivors, NCCS defines someone as a cancer survivor from the time of diagnosis and represents the millions of Americans who share a common experience, living with, through, and beyond a cancer diagnosis. In Cancer Convos, NCCS talks with survivors, advocates, caregivers, providers, and health policy experts about survivorship advocacy and public policy. For more information about NCCS, visit our website at canceradvocacy.org.
Hello, everyone, and welcome to Cancer Convos. I'm Lindsay, and I'm excited to welcome today's guest, Dr. Olazagasti, who will be talking with us about healthcare disparities during the COVID-19 crisis. Dr. Olazagasti is a second-year hematology-oncology fellow at Zucker School of Medicine at Hofstra, Northwell Health. Dr. Olazagasti's research is focused on lung cancer screening and disparities in gender and racial ethnic minorities in cancer care. Before we dive in today, I just want to say that our hearts are really heavy right now with the trauma of what's happening across the US. And we can't have a conversation about health disparities without acknowledging that current and historical racism and discrimination contribute to this issue. And at NCCS, we are committed to addressing these systemic inequalities, and we will continue to have hard conversations that help us arrive at policy solutions. We understand that our role in this is to continue to learn more and do better. And I'm so grateful for the advocates and partners who are speaking out against discrimination and calling for change in our country. So I see this conversation today as a really small step in addressing health disparities. And I just want to invite our listeners to reach out with ideas of how we might be able to do things differently and how we can continually do better. So in that vein, I am incredibly grateful to have the opportunity to hear from Dr. Olazagasti today, who is an expert on minorities and disparities in cancer care. And so, hello, Dr. Olazagasti, and thank you so much for speaking with us today.
Hi, thank you so much for having me. I'm so honored to be here today.
I'm glad it worked out. And I reached out to you after I read your article published in the Cancer Letter, and the article was titled, "When Disparities Widen, COVID-19 in Minority Patients with Cancer." And so in that article, you lay out some of the major factors contributing to the unequal burden of COVID-19 on communities of color. And I really liked the analogy that you talked about in the article. You say that, everybody's heard this saying that we're all in the same boat. And you kind of push back against that. And you say, well, yeah, some of us are in yachts, others are in sailboats, and some even find themselves in river rafts. And so I just wanted to start off by asking, can you talk about some of the factors that are contributing to this inequality right now?
Sure. I think that saying just really came from my heart because I read some of the news and some people just saying about how we're all the same, equally affected by this. And I think shortly after the pandemic started, we started hearing about this minority populations, mainly Hispanics and Black, that were more targeted and more directly affected by this pandemic. And I kind of was putting thoughts together about what I thought could be contributing to this and why did I think that this population was more severely affected. And I think it's several reasons that probably contribute to this situation. I think when you think about minorities, you think about their living conditions. They live in very high dense communities. They live in multi-generational households. They congregate together, and so it's not as simple for them to be able to do isolation if one of them is feeling sick or if one of them thinks that they have been exposed. They also live farther from medical facilities and they have higher tendencies of using public transport. So I think living conditions is one of the main reasons, but I think there's also many other factors that contribute. Their work circumstances. Many of the Blacks and Hispanic are essential workers. There have been studies that have shown that they do a lot of work for buildings or ground maintenance, food preparation services that we all know have been up and running, transportations, and even healthcare support. So that's another factor to take into account, and not also forgetting that they have higher rates of chronic health conditions. And this is something that we have seen in history and that has been very well published in different studies and articles throughout the years, how Blacks and Hispanic have higher tendencies of chronic health conditions such as high blood pressure, diabetes, obesities. And this comes lack of access, lack of medical insurance, lack of proper follow up. So I think all in all, there's a lot of factors that weigh in, and unfortunately, we've already seen how this minorities suffer in society, and this is just kind of like an additional insult that they have on top of everything else. And it's really hard to witness, and it's really hard to watch. And I'm glad that it's been put out there for everyone to recognize that this is the problem.
Yeah, absolutely. And you mentioned that minority communities are a big part of the essential workforce right now, and something that NCCS has been working on and focusing on legislatively is the paid leave issue, that especially for cancer survivors who are going to need to go back to work and or be, as things slowly open up because of their history of cancer, that really puts them in a tough spot. So as an oncologist, can you talk about what that would be like for a cancer survivor to go back to work when they're not ready, or when their, immune system was going to be further compromised by being exposed to the COVID-19?
Right, definitely. We've seen some data out there, and I think even the CDC has documented how studies have showed that Hispanics, in particular, have lower rates of access to paid leaves than their white non-Hispanic workers, and that we know that obviously someone without paid leave are more just likely to continue to work despite being sick. And here we're not talking only about minorities being affected, but can you imagine all of these issues being extrapolated to our patients with cancer? What does that mean? Not only the risk for COVID, but also the risk of just being immunocompromised, as you say, from the diagnosis of cancer. So it's very risky, but it's a very tough position that they probably find themselves in, between a rock and a hard place, because I don't think they have the luxury to just take a day off and feel like and say like, okay, I'm gonna stay home because if I don't work, I don't eat. So it's very tough, and it's a problem. It's a problem because also they don't have the luxury of being having that time off to be able to have a telemedicine appointment with their oncologist or follow up, or necessarily have the luxuries that other people in different positions have. So it's hard again to think, and it's hard to watch, and it's definitely something that we should be aware of.
And you mentioned telemedicine, and I definitely wanted to talk about that. We're working on a telehealth project right now to help define what patients need from telemedicine and identify some of the barriers to access as it gets used more widely. So, what are you experiencing and hearing and seeing with your patients, and what some of the barriers are to access with telemedicine? It's, definitely can help patients who, don't want to be further exposed by going to medical facilities, but at the same time, like so many other healthcare issues, it's not, there are access issues. And so what are some of those barriers?
Right. Think a lot of the things that we have seen with this patient population is that many of them do not have smartphones or even laptops. I think from my patient experience, a lot of the patients don't even have personal phones. They use their granddaughters or their grandsons. They don't know have an email account. They don't have Wi-Fi at home. And if they were to have a phone, a lot of times it's a prepaid phone with just like minutes that they don't have the luxury to use them without them finishing up, or they just don't have the luxury of having virtual visits. So that's definitely be a barrier to them, I think. telemedicine in a lot of ways is amazing, and but I think for this patient population, for minorities, it can be a double-edged sword because they find themselves at a disadvantage. I think the other day, a former patient of mine that has my cell phone was trying to text me because she was supposed to have a telemedicine appointment with one of her providers, and she just had no idea how to access it, and she had no idea how to log in or the logistics of it. Also, keeping in mind that many of these patients don't speak English, so trying to explain this process with an interpreter, it can be challenging.
Yeah, absolutely. There's so many barriers to telehealth, definitely. The coverage aspect is one piece also that I think is an issue and that one will definitely focus on as we move forward this project. So, speaking of access, I know last week we touched base to kind of talk about what are some of the big issues that we're seeing in the patient community right now. And access is always something that we're really, concerned about and seeing, and disproportionately affects communities of color and minority communities. So, in the big picture, how do you think that the COVID-19 crisis is going to change access in the future? I mean, telehealth is just one piece of that, but I mean, insurance companies are waiving, copays and making changes to help access right now. But what do you see kind of down the road once we're more past this current crisis?
I think I'm hopeful. I think this whole situation with the pandemic has highlighted a lot of the problems that many of us were aware that existed, but that maybe others just conveniently ignored. So I think now we clearly know that this is an issue. I think we know that there are populations that are suffering because of lack of access to care. So I'm positive and hopeful that in the future this is something that we're going to come up with potential measures and ways to remedy this problem. I don't know necessarily how they would go around it, but definitely I think it should just be a universal standard and it shouldn't be varied from state to state or from different even counties or regions. So I'm excited to see what the future holds in this situation. I think again, this has brought a very known issue for many of us, but other people maybe were not as aware. So I'm hopeful that there's improvement in their future in regards to the health insurance and access to this population.
Right. And as a provider, having to adapt to this uncertain time and things that are changing, what are some of the other ways that you're seeing providers adapting, I guess, like creatively or out of necessity to meet patients where they are right now? It makes me think of like the clinical trial process and how that's obviously being so disrupted and oftentimes derailed through the coronavirus crisis. But what other ways are you seeing practices change in this uncertain time?
I think that's a pretty interesting question and situation. I think I've mostly been in the hospital, so I haven't necessarily had that much exposure in the outpatient setting, but I've heard what my attendings are doing. I know that they're definitely trying to go above and beyond with the telemedicine and checking in, maybe touching base with family members and making sure that they're hyper aware, not only the symptoms, but they're very careful with planning process of choosing treatment or choosing when to hold off. I think what I'm seeing a lot is unfortunately when in doubt, when a patient calls in sick or you don't necessarily can't see them physically, it's been a lot of more visits to the emergency room that they have to create. But I think everyone has come up with kind of like their own system that works, trying to adapt to new normals that are really haven't been done before or established. I think from my part, I try to create like record myself, try to create a few questions in Spanish and English so people can use when they go see talk to patients my recording so that way they know how to pronunciate different words or statements. But But I think it's really just they're learning day by day. We've definitely seen clinical trials being halted. We've definitely seen patients, unfortunately, treatments get delayed. But I think all in all, our role as an oncologist is to try to be as supportive as we can for our patients. And I think that's been mainly the message that we've been trying to get across. I'm not sure that I answered the question because I don't know that I know all the specifics. Because again, it's kind of like a day-to-day thing, but that's been my experience so far.
Yeah, that's really interesting. Thanks for sharing that. And one thing that we've been reading and keeping up with, especially in the cancer community, is, the fact that routine cancer screenings are really plunging during this healthcare crisis. And, a lot of people have been urged to delay, routine mammograms and colonoscopies to help prevent the spread of the coronavirus. But, you know, as a result, we're, concerned about what this impact is going to be long term. And, that many deadly cancers may go undetected. And I know that, especially in minority communities, the screening and detection is already such a big divide. Can you talk a little bit about what you're seeing and hearing with screening?
Definitely. I think when this whole ordeal started, they were trying to put a pause on elective procedures, and I think a lot of that came with screening as well. But like you said, that's just very concerning. I've been in the hospital now during this COVID times, and I've seen the huge difference in new patients coming in with diagnosis. Typically, we see new diagnosis several during a period of a week, but people are staying home, people are afraid. So this definitely raises concerns up to when this whole thing is over. Are we going to see more people with advanced stage? Are we going to see more people that have now worse performance status because of the disease was delayed in being found or being treated because they were afraid to seek care? And I can only imagine if this affects the 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 white population, how is this going to be amplified to the minority population? There's data that has shown that minorities are less likely to have access to screening because they don't know where to go, or they don't have screening centers nearby, or because they lack health insurance. And we know that data has been published that people without lack insurance either take longer to seek medical care, or they actually forego care altogether. So it's scary to think what we're going to be seeing in the next months or even next year, but it's definitely a concern and something that's probably going to be very impactful.
Right, for a long time. As we know, cancer doesn't take a break no matter what's going on in the world.
Right.
And so I wanted to sort of conclude with something that you touched on in your article that I really appreciated. You said that the holistic and integrative approach of cancer care has never been more essential than it is today. Can you just share what that means to you?
Sure. I think as cancer providers, sometimes we just narrow our minds to treatments or how can we make sure that the patients go into remission or they can live longer. But I think the beauty of cancer care is just way bigger than that. I think it's the relationship with the patient. I think it's the love that you share for that field. I think it's the warmth that you can provide, the support, not only for them physically, emotionally, but for their families. So I think that's why this pandemic has been so impactful, not necessarily in a positive way for oncologists, because we like to hug our patients, we like to be there for them, we like to cry for them, we like to hold their hands. And I think that's very important for just their road after a diagnosis of cancer. So pausing this has kind of made things different, but I think it's our main goal still to be able to keep that in mind and make sure that that's our priority. I think we just have this as oncologists, this innate need of like serving our patients and just making sure we're there for them. And I think it's beautiful. It's a beautiful field. It's definitely why I chose it. And it's interesting to see the changes that we've had to make with this pandemic, but I think it's still hopefully deep in our hearts, and hopefully our patients can feel that it's still just as important to us as it was before this whole thing happened.
Yeah, absolutely. I love hearing what that means to you and how it's affected your relationship with your patients, and hopefully we continue to be creative in how we work to make sure that patients get the best care that they need and that they deserve. So with that, I will say thank you so much, Dr. Olazagasti, for joining us today and sharing your expertise with us, and I look forward to working with you in the future to address a lot of these inequalities. We have a lot of work to do. And like you said, now is, an incredibly important time to be doing this work and focused on this. So I'm so grateful that you took the time to join us today.
Thank you so much for having me. And I think today more than ever, what we're seeing in the news, it's very important to speak about it. It's very important for people to know that these are problems, and this has to be highlighted. And I think this you guys are doing a great job doing so. So I'm looking forward to see what the future holds.
Thank you.
Thank you.
Thank you for listening to Cancer Convos. You can find a link to the mentioned article by Dr. Olazagasti in this episode's description. On our next podcast, we'll talk with people currently undergoing cancer treatment about surviving cancer during a pandemic. Our guests will share how they're coping, finding support, and how they're continuing their advocacy. For more information about cancer advocacy, policy, and helpful resources for survivors, visit NCCS at canceradvocacy.org. To find resources on COVID-19 and what cancer survivors need to know, go to canceradvocacy.org/COVID resources. Cancer Convos is sponsored in part by the Pfizer Foundation. Thanks again, and tune in next time for more Cancer Convos.